Hello, it's Bruce Williams again, and today I would like to present Part 9 of my series on the selected gross pathology of avian species. And lecture number 9 is going to cover, as promised, the musculoskeletal system. We're going to start with the bones, then we're going to look at the muscle, and we're going to end up with a couple of joint diseases of import in avian species. As I do at the beginning of all of my lectures, I want to thank my friends and colleagues, especially you, Ron Porter, who have provided me such great images over the years, which allow me to put these lectures together. Here's a common husbandry practice in large producers. We've looked previously in other lectures at diseases associated with trauma, diseases like cannibalism, vent picking, and gangrenous dermatitis. And so one thing the producers will do to lower the incidence of these problems in their flocks is to take a hot iron and cauterize the end of the beak in day-old chicks. It takes the pointy part out, makes it more difficult for them to peck at things, doesn't impair their eating unless it's done improperly. There's always a little bit of improper technique where they're cut too far back, or they are cut unevenly with the bottom one or the top one much farther protruding than the other, which makes it difficult for the birds to eat. But usually this is a very safe practice which improves the production within the facility. Okay, let's look at a common vitamin deficiency or mineral deficiency, which can affect both young birds and older birds. And this is a combination of calcium, phosphorus, or vitamin D, particularly vitamin D3 or cholecalciferol. Young birds are born somewhat calcium deficient to start with. If they're not supplemented with calcium, or the ration is improperly balanced, then you will very rapidly see clinical signs of deficiency within these animals. Misshapen bones, very soft bones. As we see here, the animals will just sit down, not move around, and their growth is severely impaired. In this case, the ration needs to be evaluated significantly. In young birds with rickets, vitamin D and calcium need to be especially evaluated if there's going to be a good outcome to this situation. As the animals age, you may see signs of previous lack of vitamin D3 or calcium, including abnormalities of the keel bone in this great picture by Dr. Sarah Vitash of University of Nebraska. Another problem that is commonly associated in older birds, young adult or older layers, is something called cage layer fatigue, which is a long-term deficiency of calcium. Remember that a large hen will mobilize 10% of her skeletal calcium into the eggshell every day. It's about 1 gram. And it's got to come from somewhere. It doesn't come straight from the diet. It's mobilized by the bone, from the bone, with the help of the parathyroid glands and parathyroid hormone. Without proper supplementation, the bones of these birds will become thickened as a result of mobilization of bone, replacement with fibrous connective tissue, and the animal's bones will become soft, easily bent, including the beak. You'll see the beating of the ribs as seen here, curved keel bones as we previously saw. The birds actually may become paralyzed by calcium deficiency, known as cage paralysis. And the lack of exercise and stress on the bones, because these animals are penned in cages, contributes to this problem. These birds may die as a result of starvation or dehydration. You may see broken bones in these animals, or the bones may break when the animals are transported. A high calcium diet will prevent this if given 2 weeks prior to the first lay. Here's a great picture of an older condition known as porosis. Nowadays it's called slip tendon or chondrodystrophy. And this is seen in young birds whose diet is deficient in one of a number of different minerals or vitamins, including choline, nicotinic acid, manganese, biotin, folic acid, or pyridoxine. The lack of one or more of these compounds in the diet results in deformation of the leg bones and a twisting or bending of the distal end of the tibia and the proximal end of the metatarsus, giving very shallow grooves or condyles, which the gastrocnemius tendon generally rides in. And so the tendon is very prone to slip out of that groove, giving it the name slip tendon. Clinically, affected birds will show lateral or posterior malpositions of the affected legs. Here's a great classic lesion that you can see in rapidly growing broilers or turkeys. And it's seen in the proximal tibial physis. It's known as tibial dyschondroplasia. And if you eat a lot of chicken and you always carry a pocket knife with you, sometimes you can cut the tibia and see this lesion. It's not always seen in the tibia, but that's the easiest place to find it. You can also see it in the tarsus, the humerus, and the femur as well. But the proximal tibia is the most common and best location to find it. And what you see are these triangles of unmineralized cartilage, which go down into the diaphysis, and usually starts between 3 to 8 weeks of age, in the period of the most rapid weight gain in these birds. There's been a lot of things that have been proposed to cause this over the year, in addition to rapid weight gain, including genetic factors, an improper calcium to phosphorus ratio, fusarium toxin, pesticides, and various antifungals and coccidiostats, deficiencies of copper, too much chloride, and a host of other problems have all been unsuccessfully incriminated in the formation of these areas of mineralized cartilage. These triangles of cartilage probably arise as a result of a lack of a vascular penetration into the physis and failure of normal endochondral ossification. Histologically, you get an elongation of the area of chondrocyte hypertrophy, minimal vascularization at this point, an increased cross-linking of cartilaginous collagen, which prevents the ingrowth of the vessels, chondroclasis, breakdown, and influx of macrophages to resorb the mineralized osteoid. Tibial dyschondroplasia, a great lesion. Here's one that is seen occasionally in rapidly growing broilers. This is spondylolisthesis, or kinky back, usually seen once again at the time of the earliest or the highest growth rate in these birds. And these animals, probably genetically driven, as well as pushed along by high growth rates, have an upward deviation in the vertebral body of T6, resulting in spinal cord compression right here. Obviously, these animals are going to have difficulty with locomotion, and this will impact their rate of feed conversion if they can get to the feed at all. Okay, let's move on to a couple of viral diseases that affect bones. There aren't a lot of viral diseases that affect bone in the animal kingdom. Birds seem to be a little bit overrepresented. And this is a great old picture from the AFIP. And look at the size. This one's almost normal. But look at the size of the shanks on these chickens. They look like they're wearing cowboy boots. And this particular disease, osteopetrosis, has been associated with a number of colorful names due to this appearance. These birds are called cowboy chickens, and the circumferential enlargement of the metatarsus is known as boot shanks. This is another disease that may be associated with forms of the avian leukosis retrovirus, in this case, exogenous strains of replication-competent virus. And these cause a really marked circumferential periosteal new bone growth along the long bones, which is best demonstrated here in the unfeathered skin of the metatarsus. Osteopetrosis in mammals is a very different disease, usually as a result of a genetic defect of the ruffled border of the osteoclasts. In birds, it is virally induced. Viral infection results in an altered differentiation and growth of osteoblasts. It's not an osteoclast lesion at all. So birds, it's osteoblasts. Mammals, it's osteoclasts. And then you get these altered osteoblasts form a lot of irregular, very basophilic periosteal new bone. The osteocytes themselves are big, their Haversian canals are abnormal. And rarely, these birds may subsequently develop lymphoid leukosis, to add insult to injury, so to speak. And here's some great images showing you the marked growth, assuming that this is a normal bird or control bird. This is the abnormal bird, and you can see the size and the tremendous periosteal bone formation induced by viral infection of osteoblasts. Affected animals will have an abnormal gait, as you can imagine. They may have elevated alkaline phosphatase due to the periosteal bone growth, and they may have a virally induced anemia. As we said before, they may go on to develop lymphoid leukosis in a couple of cases. The lesions are usually bilaterally symmetrical. They are circumferential, and other bones that might be involved include the ribs, the pelvis, and the bones of the shoulder. Generally does not involve the digits. Moving on to another viral disease which will affect the tendons and bones of birds. This is a very classic lesion associated with hemorrhage from rupture of the gastrocnemius tendon. I am very sympathetic to this bird because I just got back from the doctor yesterday. He told me I have a partially torn or Achilles tendon on the left-hand side. And I've been sort of gimping around for a couple of months now. I wasn't exactly sure, and it was very simple for him to figure it out because he had me stand on my good foot and holding the bad ankle in the air and raise myself up on my toes, and I could do that. And then he had me put my weight on my bad leg and said, get up on your toes, and I cannot lift my heel off the ground. So if you think, it just means I don't have enough functional tendon there. So if you think you might have damaged that tendon, it's a great, easy test to see if you have damaged your Achilles tendon. Okay, but let's get back to this bird. This has traditionally been associated with avian reovirus infection in birds and viral tenosynovitis. But many cases have proven not to actually be inflammatory. The gastrocnemius tendon of meat birds, has sort of a hypovascular area right above the hock joint, which is probably prone to rupture in heavy birds, or if they're running away from a more aggressive, if the big hens are running away from aggressive breeding males, they may injure and rupture this particular tendon. But you will see it in the literature associated with reovirus infection or potentially staphylococcus infection. Here's another case of gastrocnemius rupture. Associated, as you can imagine, with lameness. Some people call it viral arthritis. So I think if I saw this on some form of examination, I would probably go with the classic reoviral rupture of the gastrocnemius, but a couple of other things that might cause this. I think trauma is a major cause of this. Mycoplasma synoviae may cause a tenosynovitis in this area. So keep your mind open on this one. Here's a great picture by Ryan Traslavina, probably when he was at University of California at Davis. And this is Bacterial Osteomyelitis. In broilers, most often associated with a couple of different bacteria, Staphylococcus aureus, strep, or Enterococcus faecalis will all cause lesions. The abscesses are often seen in the proximal epiphysis of the femur, the tarsus, the metatarsus, and the 5th to 7th vertebra. Something about those 5th to 7th vertebra, a lot of problems there in birds. And you get these areas of mostly caseous inflammation. Birds don't do pus very well. Their heterophils don't have a lot of myeloperoxidase. They don't tend to liquefy acute inflammatory lesions. Oh, this one's doing a pretty good job right here. So a lot of times what you get is sort of this, sort of caseous exudate. But that's a bird's equivalent of an abscess. And these particular bacteria, Enterococcus and strep, can cause infections throughout the body. They can cause arthritis, synovitis, draining sinus tracts, and in a chronic lesion like this, you may get a formation of a sequestrum, or a focus of necrotic bone in the center of what appears to be viable bone. A lot of times when you get a tremendous collection of heterophils, it'll have a very greenish exudate. In early cases of this were known as green bone disease. Enterococcus cecorum is another commonly isolated bacteria, especially in the vertebra. And animals will get these vertebral abscesses, these transverse fractures at T6 or T7, compress the spinal cord and obviously will become severely lame or paralyzed, and they often will walk along on their wings. Signs are similar to what we would see with spondylolisthesis. This is a great picture of a vertebral abscess with a pathologic fracture by my good friend Rob Porter. Well, I've given you a big list of bacteria: staph, Enterococcus, cecorum, or faecalis, or strep. One of the other bacteria that often will make its way into the bones, and this would be an older bird, probably a zoo bird or a pet bird, not poultry, would be Mycobacterium avium. We've seen that a lot in these lectures. And you don't see it much in poultry because they just don't hang around long enough to develop these chronic granulomas. But if you do see Mycobacteria, make sure that you split those bones because you'll probably find granulomas in there as well. Here's a large blister with fibrinous exudate over the keel bone of a bird. And these are known as breast blisters, also known as sternal bursitis. And in poultry, there is a bursa lined by a synovial membrane over the most anterior projection of the keel bone. The majority of these particular blisters are seen in heavy birds, which spend a lot of time down on their breast muscle in suboptimal conditions, including coarse bedding or chronically wet bedding or hard flooring. And it's often birds that are poorly feathered in this area and have leg weakness. So there's a reason that they're down, and if they stay down long enough, there can be trauma. You can isolate a number of bacteria out of this. There are ways for the bursa to become inflamed as a result of septicemia, so you may see it in association with Mycoplasma synovii or Pasteurella as well, but it's usually traumatic in nature. Another traumatic lesion, this great picture by Kim Newkirk, which you will see in birds on either side of the keel bone, are injection sites. That's where you inject birds. Okay, that's the largest mass of muscle that they're not going to use that much. You don't want to hit them in the leg. So this is just an injection site. And if you looked at this, you would see a lot of necrosis, heterophilic and histiocytic inflammation, and maybe some of the injection material as well. Another condition that is seen often in really big birds, these big Thanksgiving turkeys, or perhaps just really big broilers, is a condition which used to be called green muscle disease. Remember, you get a lot of heterophils together, they're going to look sort of greenish. And you see this deep in the pectoral muscle. Here's the keel bone right here. You see it deep in the pectoral muscle. And it is called deep pectoral myopathy, sort of akin to March gangrene, which young soldiers who were not in good shape would get after prolonged marches. And it's a form of compartmental syndrome, because these animals have grown so much, they have put on so much muscle, and whenever you put on a tremendous amount of muscle, the connective tissue and the vasculature often does not catch up. And so what happens in these big birds is they get up, right before they go to market, and they flap their wings, and they got all this muscle, and they generate a tremendous amount of pressure on a very overstretched vascular and fascial system. And they will cause, necrosis of the muscle, and then the muscle will begin to swell, and it's encapsulated in this tight fascia. And the edema causes a vicious cycle of necrosis and more edema and hemorrhage, and then more necrosis, because the muscle does not have the room really to expand. And you get these focal areas of necrosis deep in the pectoral muscle, which are not particularly attractive for your Thanksgiving turkey. So this is deep pectoral myopathy, also often seen because it's so well demarcated, and often has sort of a greenish appearance to it. Here's an interesting parasite of the skeletal muscle in birds. Hemoproteus is a very common blood parasite in birds, especially non-domestic birds, with over 120 different species. In quail, as we see here, and usually most birds it doesn't cause any problem, but in quail it can cause marked mortality in quail flocks, with up to 20% of the birds being lost. The megaloschizonts will appear within the skeletal muscle, especially of the breast, the legs, and the back. And you get these large white and hemorrhagic streaks throughout. The animals are reluctant to move, or they can't move, and as such aren't going to be able to get to water or feed. This is Hemoproteus lafortix of bobwhite quail. Another parasite of skeletal muscle is seen in ducks. This is a great picture by Jamie Rothenberger, and it shows these sort of rice grains, as hunters will call them, within the breast muscle. This is not a bad infection. Sometimes you'll see it where it's almost all sarcocysts, and this Generally doesn't cause a lot of problems for the birds. If a severe infection may make it difficult for them to fly, I suppose, but most of the cases are seen in hunters, and they want to know if they can eat it, and I suppose you can if you cook it well. I don't think I would particularly want to, but this is Sarcocystis riley. Oh, here's a multifocal white streaks in large areas of pale, fibrotic, previously necrotic muscle, which can be seen as a result of previous administration of ionophore coccidiostats. The basic mechanism behind drugs that we use, like Monensin, to treat coccidia, is it causes a derangement in the sodium-potassium pumps in the walls of the coccidians. They get flooded with water and they explode. Gross oversimplification, but I am prone to my occasional oversimplifications. Well, in a number of animal species, and there is a whole variety of species susceptibility to this, it can also often cause changes in the cell membranes of skeletal and cardiac muscle, especially in horses. And what happens is you have cellular loss of potassium, and you have a influx of calcium across cellular membranes or organelle membranes. And when you get calcium into the mitochondria, it is going to result in destruction of the mitochondria and ultimately cell death. So ionophore toxicity is seen both in skeletal and cardiac muscle. Most of the cases, at least in mammals that we see, are due to cardiac muscle damage because we don't tend to focus on small skeletal muscle lesions. You'll see them as well. When the animal drops dead because of cardiac necrosis, it tends to get people's opinion. Well, this is a case of ionophore toxicosis in poultry. Okay, let's finish up with some diseases of the joints. Here's some rather large joints here in the legs of a broiler. The animal has a serofibrinous tenosynovitis. If you incised it, you would get this sort of gooey type of exudate. And this animal is infected with Mycoplasma synovii. We've talked about it a couple of times. We just talked about it in association with keel bursitis. In certain parts of the country, like here in Maryland, some of the lesions of sinusitis, which we have traditionally associated with Mycoplasma gallisepticum, often now are caused by Mycoplasma synovii. This organism usually colonizes the upper respiratory tract and causes subclinical infections, but can get loose in the body, invade synovial membranes, resulting in tenosynovitis and lameness. It's transmitted vertically through eggs. The vast majority of infections happen that way, and you usually see it in chickens between 4 weeks and market age. Mortality is not much, but the birds usually lay on the floor with these swollen hocks or foot pads, as seen here. And we've seen the thick, viscous fluid that you can see in the acute cases. Chronic cases that are still around, you can have. Okay, sorry, I had a phone call. In chronic lesions, you're going to get sort of a chronic synovitis, maybe some fusion of the tendon sheath and the tendon. And it's going to be unable for these animals to compete for food or water. So not a good long-term prognosis for these animals either. Oh, okay. Classic disease. We've looked at gout in chickens in terms of visceral gout, in terms of renal gout, and we got a lecture coming up, a short lecture on the urinary system. And in those cases, it tends to be the result of dehydration, or renal damage, inability to excrete uric acid, to get rid of it. So when you superimpose the inability to excrete with dehydration, you're going to get precipitation of urates within the renal tubules. So ultimately, you'll see it on serosal membranes. And the visceral gout is seen usually as a low percentage background lesions, and even the best flocks will have a little bit. Well, this is articular gout, and it's a little bit different. It's not really based on dehydration and inability to compete. This is probably the result of a combination of factors. Probably birds that have some hereditary problem with excreting uric acid metabolism, and or those that are being fed excessive proteins or excessive protein in the diet. So it's certainly, if you have an animal, and it's sort of similar to what we see in people, it's a uric acid metabolism defect. It's genetic. Not a large percentage of the population have it. Usually affects the digits. But in birds, you can see it in a number of joints, including the digits, including the joints of the hock, even the wing. But it's probably a genetic predisposition to being unable to metabolize uric acid properly, compounded by too much protein in the diet. Wow, here's a great, and it's these chalky accumulations within the joint. They don't really look much like anything else. So you can also see this in reptiles as well, especially turtles tend to get it in various joints. And our last picture for this lecture is a great picture, beautiful picture by Dr. Ivan Galindo of amyloid arthropathy. As you can imagine, these animals would have a very odd-looking stunted gait, once again, not being able to compete very well. But notice the color of the feathers. This is a disease that is primarily seen in brown layers as opposed to white layers, and is almost always associated with Enterococcus faecalis infection. Okay, a couple of other studies on this, a couple of other bacteria have been isolated, including Staphylococcus aureus, Salmonella, and E. coli, but none of those particular agents were able to produce the amount of amyloid within the joints as Enterococcus faecalis. So, disease of brown layers, a wonderful, colorful picture by Dr. Ivan Galindo, and a great way to bring this lecture to an end. Well, we only have 2 more lectures in this series. I'm going to give a brief one on urinary system. It's Saturday here at the JPC. You've got people working on the roof today, making some noise, but I hope it is not interfering with you understanding these lectures. We'll try and knock out urinary system, and then finally we will finish with the be-all and end-all of the chicken, as far as I'm concerned, the reproductive system, where those eggs come from and diseases associated with. We'll try and get those all knocked out today, and then hopefully next week I'll be able to move on to my next series of lectures on reproductive pathology across animal species. Hey, thanks for coming by on a Saturday. I do appreciate you listening. I hope you're getting something out of these lectures, and please come back frequently to our Foundation Facebook page and our YouTube channel. Have a great weekend.